Welcome to Morocco. Let's go.
Medicine 101 podcast, where we break down complex medical topics in a very clear way to understand, and we shine light on public health disparities as well. For this month's episode, we are very honored to welcome Dr. Imane Tarib, and I'm your host, Jihan Itsesi, and I'm very excited for Dr. Tarib to join us for this month's episode. Dr. Imane Tarib is an ophthalmologist who specializes in cornea, anterior segment, and refractive surgery. She is originally from Morocco, where she earned her medical degree with honors from the University of Sidi Mohammed bin Abdullah in Fez, and completed her residency at the Military Teaching Hospital, Mohammed V, is that correct? In Rabat. She then pursued research fellowships in digital health and refractive surgery in the United States and completed advanced clinical training at some of the most renowned institutions in the world, including the Cleveland Clinic and at the University of Illinois Chicago, the Bascom Palmer Eye Institute, as well as the Johns Hopkins Wilmer Eye Institute, where she currently is an associate professor. Beyond the clinic, she is a scientist, educator, and content creator who is dedicated to advancing equitable eye care, from improving eye donation systems to expanding eye access in underserved communities, an inspiring role model for aspiring physicians and women in STEM. We are very honored to have her here. Dr. Tarib, welcome to the Medicine 101 podcast.
Thank you so much, Jihan. I'm really honored for the invitation, and I'm more excited because it's with you, and we are both originally from Morocco, which makes it even more special. It's truly a pleasure to be here and hopefully inspire the younger generation.
Wonderful. Okay, so without further ado, we can go ahead and get started. So you completed your medical education in Morocco before making your way here to the United States to pursue higher competitive fellowships within ophthalmology. What was that transition like, and what unique challenges or advantages did you experience within ophthalmology, and also as an international medical graduate?
That's a great question, and I could talk about this for hours, but I'll try to make it pretty concise. I must say that I like to think of eyes as a language, and it's a universal language. You know, as an eye doctor, whatever I see in Morocco, I see here, I could see in Germany, I could see anywhere, right? But when it comes to practicing as a physician, there are different things that apply to being an ophthalmologist here versus Morocco. The first two things that come to mind are going to be language, of course. And with language, you have this kind of higher barrier in connecting with the patient, because it's not just about examining patients and giving them a diagnosis and coming up with a treatment plan. It's also about building a relationship with these patients. And that requires a lot of trust and good, efficient communication, which took me some time when I moved to the US. Having similar background with my patients in Morocco helped a lot. But then I came here and you have patients from all around the world. So I had to educate myself about different ethnicities and different religious groups in different countries in the world, and how different people celebrate different things, and how different people think about things such as organ donation and organ transplantation. And so that was definitely two of the big differences that I encountered, but it was a wonderful learning experience trying to navigate those.
That is very inspiring. And I can say, like, not growing up in Morocco, but my parents both growing up there, the healthcare system, like you said, is very different than here in the US. And so it's very interesting to see how you navigated that transition. And there were obviously things to get used to, but overall, I would say it's very inspiring.
Thank you very much.
So, as you mentioned briefly, ophthalmology sits at this fascinating intersection of precision technology and very profound human impact. Restoring or preserving someone's sight is truly life-changing. What drew you specifically to this field? And I know you kind of just talked about it, but specifically, like, what was there a defining moment or experience that made you want to do this? And ophthalmology does require surgery as well. So did you always see yourself going into surgery in particular?
Yes, when I started medical school, I knew for sure that I wanted to become a surgeon and I wanted to become a cardiothoracic surgeon at first. And then when I got into medical school, I became more fascinated with neurosurgery, believe it or not. But that was very brief because as soon as I spent time doing my clerkship in neurosurgery, I remember very clearly scrubbing into a vestibular schwannoma surgery that lasted until 3 in the morning. And that's when I decided that that's not meant for me. I couldn't see anything as the medical student. It was very far out. No matter how much my professors tried to include us and explain things, I couldn't get anything. So I thought, okay, it's time to find something else. And I wanted to be a surgeon really bad. And so I tried to navigate my medical school education and trying to find interest in different surgical specialties. And I was drawn to ENT, ear, nose, and throat first, because my grandfather, God bless his soul, had lost his hearing because he was part of the army that helped actually for the independence of Morocco. And so he had lost his hearing because of the use of, all the artilleries and all of those things. And so my grandfather had always had loss of hearing, but then one day he discovered that he had advanced glaucoma in one of his eyes and was left with tunnel vision. And he was really devastated. And I saw how that impacted him versus the loss of hearing. And he told me, he said, even though we have two eyes and two ears, he said something in the lines of, it doesn't even compare. The ears are nothing compared to the eyes, is basically what he said. And that got me really interested in ophthalmology. And so little by little, I started getting more exposure within medical school, especially in my internship period. And that's how I ended up an ophthalmologist, and I love it.
That's wonderful. You just mentioned glaucoma. I actually research glaucoma in my university, in the honors college. I work with a team of students, and that's actually like our focus of research. And we're trying to essentially develop like a therapeutic treatment utilizing stem cells. So yeah, that's very
That
interesting.
is incredible. That's truly one of the most fascinating fields because this is still something that, there's nothing more devastating than diagnosing your patient with a disease and saying, there's nothing we can do. For glaucoma,
Mhm.
most of the time you say, I can try to stop the progression of the disease, but what's lost is lost. And so using stem cell therapy in trying to rejuvenate those nerve fiber layers is definitely one of the most exciting parts of ophthalmology. So good for you.
I love stem cells. That's honestly my favorite part of research.
We also use them in cornea. So in case you end up being an ophthalmologist, you can also join our camp.
Okay, I will definitely make sure that's on my list. For sure. I would be honored to work with you, like truly.
Oh, you're too kind.
So, medicine and surgical subspecialties in particular have historically been male-dominated spaces, and this is like known like across the world, not necessarily only for one specialty, say ophthalmology, but as a female physician in ophthalmology, what barriers did you encounter along the way, and how did you navigate them? And then, what advice would you give to students who are females and want to pursue medicine? And you can also answer this from the standpoint of being someone from Morocco or minority in that sense.
Yeah. Thank you so much for asking this question. I think this is a very important thing that sometimes we shy away from bringing up because we think that that would make us even weaker. But I believe in the opposite. I believe in talking about these things more and more in order to normalize having women surgeons in the field because it's not about numbers. I mean, the numbers are going in a really optimistic trend now where we're seeing more female surgeons. But the reality of the practice of surgery, which I was surprised to learn that it was almost the same everywhere. I thought at some point that it was maybe worse in Morocco. And then I went to Europe and I thought, oh, maybe it's worse in Europe. But then you come to realize this is something that everybody experiences all around the world. And I learned a lot about this through social media, actually, through following content from my colleague female surgeons, not only in ophthalmology, but other surgical specialties from all around the world. And we all go through the same things. I would say some of the bigger things that I had not only to face, but to learn how to navigate is the expectation of different programs and different people in general that you as a female coming into a surgical specialty are just going to want to do the basic things. You're going to want to stick to doing the bread and butter of the surgical specialty, and you're going to want to stay away from the complex parts of the surgical specialty. I think that can be true for a lot of people, whether they're female or male, and that's completely valid. But what I had personally to fight is the fact that I always wanted to go for the hardest things and the most complex things, and I wanted to be that person who knows how to address all the problems that can come through my door. And a lot of times you can find or face this resistance, not from a bad intention. Most of the time, it's actually from a good place where some mentors can think that, oh, you don't have to scrub into this case. You're done for the day. You're okay, because this is going to be complex, or we don't know what's going to happen with this. But then you have to stand your ground and to say, no, my goals for my training are A, B, C, and D, and I am spending as much time and effort as my other colleagues. And so I am going to reach those goals. And you have to be very diplomatic in the way that you navigate this, because it's very easy to stick bad labels to women, and that doesn't help us. So I think that shedding the light on the problem is important, but it's also as important to teach our women surgeons the right skills to help them get into a better situation. And the more of our female surgeons do that, the more empowered they are, and the more the younger females within medicine are going to be empowered to pursue a surgical specialty where they do not see that women have a disadvantage just by being born a female, which is completely absurd, right? So this is the most important thing, I think, is to recognize the issue and learn how to navigate it. And the way you're going to learn how to navigate it, well, first of all, it's going to be a lot of trial and error. But before you do any trial and error, you have to reach out to mentors. You have to talk to people who have done it before, because maybe you can see a lot of shining things about people's career on social media, in real life, in the hospital, but you don't know what struggles they had gone through in order to get to where they are. And so the more you ask these mentors and the more you encourage sharing their experiences, the more you will learn from the way they navigated that. And I think it's important to also always highlight successful women in surgery, because the younger generation of medical students and even kids in high school need to be able to see female surgeons who are killing it, so they can see themselves in them and they can also have the drive to achieve what these women surgeons have achieved.
I mean, I'm truly blown away by your response, Dr. Tarib. It's really sad, obviously, like you said, that this is still reoccurring in 2026. But I think leaders such as yourself and physicians within the social media space in particular are really paving the way for girls who don't necessarily come from privileged backgrounds, to understand that then they have people to support them. And I totally understand what you say about mentors, because I know for me personally, like I would not be where I am today without incredible mentors. And I'm sure you are such an
Same for me.
mentor. Yeah, yourself. And so I think it's very important, obviously, to continue advocating for this. And I would hope that in the coming not even just years or decades, but the movement of female empowerment never stops. And certainly I don't think it ever will.
Yes, I
Um,
think we are on the right path, and the more space we take, the more it's going to help our cause. That's why I always try to encourage young women in general, whether you're in medicine or not, to just do not shy away from advocating for yourself and from speaking up your biggest, wildest dreams, because it starts with that, and then you get to actually achieving your dreams, and then you have to show it off. People have to know about it, because who knows, maybe a little girl somewhere doesn't think she can become an eye surgeon someday, and then maybe she'll see a post that I make, and then it will become her dream. You never know. So I encourage you and all your friends and people who are listening to this to always advocate for yourself. And the power of community is truly immeasurable. So the mentorship part is definitely a very, very important aspect of this journey.
I couldn't agree more. You kind of answered our next question, is the I guess aspect of being a medical creator as well, medical content creator. So I'm sure many students, or not even students, but individuals across the world know that you have a very significant presence on social media. And this isn't something that a lot of clinicians take on, but it definitely is increasing within the coming, I would say, past few years. what has that experience taught you, and where do you see the role of social media being taken within public health? And that could be democratizing medical knowledge and its risk of amplifying misinformation. And I know this is something you're very passionate about. So if you don't mind giving us your take on it.
Of course. So I'll tell you, it's funny. I started my social media back in 2014, right before I started my residency program in Morocco. And I was honestly just curious to know how other residents in ophthalmology around the world are spending their residency. How is their medical training? How is their surgical training? How is their life outside of residency? So that was very helpful in creating a really significant international ophthalmologist community that has helped me tremendously throughout my career. But then the more I got into content creation, I discovered more and more that there is just an ocean of misinformation out there. And perhaps the way I like to say it is maybe the doctors that are on that space are maybe half of this cup, compared to an ocean of misinformation. So we have so much to fight on these spaces. And now, whether we like it or not, a big majority of our patients come into our clinics getting their information from social media, whether for ophthalmology, for example, whether that is for refractive surgery, cataract surgery, people with eye infections. People are getting a lot of misinformation from social media when they could be getting better information if clinicians were more involved. Not that clinicians have plenty of time to do this, but I would highly recommend if someone, for instance, are in their medical training to start having a presence, because you have no idea how much value you can bring to the social media space. There is just so much falsehood in that space that is provided by people that have absolutely nothing to do with healthcare, that people unfortunately just believe. I get a lot of patients that come with complications because they listen to someone tell them that they, could go and get some surgery to change the color of their eye, or that they could use some weird thing as an eye drop. And so I think social media in my journey has been useful in two folds. Number one, it has helped me in my career by connecting me to other colleagues from around the world, but also helping me to learn about how other colleagues are doing their surgeries, other colleagues' publications. I felt like I was always updated effortlessly. Okay. The second thing is that as a physician, now that I started my job as an attending, I get patients who tell me, hey, I follow you on social media. Thank you for making a video explaining about so and so. I either didn't understand it better before, or I either had a wrong idea about it. And I think that bringing that awareness is empowering to our patients and helpful in our practice. So instead of my patient coming to me with all these bad or wrong information, maybe now if they watch one of my videos or my colleagues' videos, they'll come with actual useful information that'll make their time in the clinic more efficient. So all of this to say that this social media space is here to stay as things are standing today. And I think as medical and healthcare providers, it is, I wouldn't call it a duty, but I would call it definitely something like a good deed, It's almost like a good deed if you volunteer some of your time and effort and create something that can be useful to people around you.
That is such an extraordinary response. And I started following your page, I think I want to say almost a year ago. And as soon as I found out that you were Moroccan, I was like, oh my God, this is like the world is so small, like truly. And then
That's right. And Moroccans are everywhere.
They really are. No, they really are. And my page just started like opening up to all of these other Moroccan physicians.
Yeah.
But I would say one thing I really did appreciate about your social media in particular, and this is the case with a lot of these medical influencers who are physicians, of course, is just how you're not afraid to show who you are, to show yourself. And I think there's kind of a taboo thing in particular with physicians being in that content creation space, with being, I don't know, some people say it's quote unquote not professional, but I very much think that, being a physician and showing your patients requires humanity and requires personality. And I think that's one thing that I've seen you always prioritize. And I mean, as a Moroccan, I really, really appreciate it.
Thank you, my dear.
Of course. So here at Medicine 101 podcast, and you kind of talked about this briefly, we are very passionate about translating science in a clear and accessible way, and just highlighting how important it is in a space where it is very filled with misinformation, particularly within, our government, etc. And this is very much aligned with your own work within social media and just in general. So how do you approach this responsibility within your research? Because I know you've done plenty of research, and you've also written chapters of books. So you're very experienced in the field of ophthalmology. So what do you prioritize when it comes to upholding this responsibility? And then how do you ensure that this is faithfully done within your work, I guess?
Well, I'll go back to the idea of mentors, right? There's always someone who has done what you want to do, either more times or better. And so I think that, I grew up in kind of a culture that encouraged the I will figure it out mentality. Okay. So if there's any type of issue at life in your career, you just gotta work hard and figure it out. In medicine, what's wonderful is that you can figure it out easier and faster and in a much, much more efficient way if you reach out to mentors. And so every research that I have been part of, it was part of a team. And there's always a mentor and someone who has done something that more than me, right? And so they would guide you in the way on how to approach this research. Every time I tried to start a project by myself, even though I am leading it, I would have mentors that help me with statistical approaches or ethical approaches, and think different things and different ways that can make the work ethical, efficient, and actually usable. I really love the idea of pushing the boundaries of medicine. And I always think, whenever I think of a research project, I'm trying to push a barrier. For instance, working on access to corneal tissue and corneal transplantation in so many countries in the world is a big passion of mine because I see it being done in the United States so efficiently and so seamlessly that it almost doesn't make sense to me anymore why it is not possible to be done somewhere else, right? And so, for instance, approaching this question, I don't only need my ophthalmology mentors. I need people who understand in economics. I need people who understand politics. I need people who understand religious backgrounds of these countries where perhaps there is a belief that organ donation is not allowed, things like that. And so, always reaching out beyond your own limits will get you much farther in research than if you just want to do it within your limited circle. So that would be my biggest advice. The second thing is that now with the AI being into place in a lot of what we do, I would highly recommend learning good, very good, efficient research skills, including statistics, without completely relying on AI. Because we have all these tools that can do all of these things, but knowing how to do it yourself, knowing how to collect data, knowing how to analyze data, reading the papers to make your discussion part of your reading your references to make the discussion part of your paper is never going to be replaced by you just feeding it to the AI to make it for you. So I think that's part of the ethics of using AI in medicine, and that's a very important point when it comes to research.
I can definitely relate to the AI part because I do work in a lab currently within my undergrad institution, which is the University of England. And it's so interesting because I do a lot of data analysis, and I've tried before to put it into platforms like Claude, ChatGPT, and it very much gets it done. But unfortunately, like what I've seen happen is, people in many ways taking advantage of that. And I think there's always a fine line that cannot be crossed when it comes to AI. So yeah, I think AI is definitely an interesting field, and it's I'm sure like it's been very helpful within medicine, but especially as students, it is critical for us to know how to do these very basic, in many ways, skills and processes to not only be a good physician, but also scientist, or physician scientist, whatever the case is. So thank you so
Absolutely. And
much.
you know what?
Go ahead.
The analytical mindset in approaching, I learned this from Dr. Randleman. I worked with him in Cleveland Clinic. He's like, you can't just be reading papers and thinking, oh, great finding. No, you have to be, or great conclusion. You have to have the analytical mind to look into the way the authors approach the statistics, for instance, and ask yourself the questions, why this and not something else? And how would I approach this specific question if I was doing this study, for instance? And so these are things that you need these reflexes, even as a clinician. Let's say you have zero interest in research. you as a surgeon or a doctor in the future are going to rely on research heavily in making your clinical decisions. And so if you have to pick, let's say, between treatment A, B, and C, you're going to have to look into studies to pick which one. And to do that in an efficient way, you're going to have a very good analytical mind in approaching these papers to make your mind, because not all of them are going to be like comparing oranges to oranges. Most studies are going to be done in very different ways, but you're still going to have to come up with your own conclusions in order to make your own clinical decisions that will impact your patients' lives. You know what I mean?
For sure. And it's interesting, one point about reading papers, that's something I always found, like, had trouble with because of how dense papers can be. But what I'm thankful of is with practice, you kind of just learn that, even if it takes a few days, a week, sometimes, that's totally fine as long as you can annotate it deeply and yeah, and understand. And I think what I've seen is like AI could help people understand like what the paper is saying, if it's too complex in many cases. But I think even in that sense, once you become more experienced, you'll just naturally know like a lot of those abbreviations or terms and whatnot.
Yeah.
So that it's very interesting to hear how it's used within the physician realm, like within choosing a treatment, for example, like research, obviously, and reading papers. So thank you for that point, Dr. Tarib.
Of course.
Uh, and for our final question, which is what we'll close with, if you could sit across from your younger self, just starting out on the long road towards becoming a physician and researcher, not who you are today, what would you tell her? And a follow-up question to that would be, what would you tell aspiring medical students or pre-meds who are listening to the Medicine 101 podcast right now, in terms of kind of like one takeaway they should take with them? Because I'm sure the journey is incredibly long, incredibly tedious, and just difficult to simply put it. What would you recommend for them to always remember throughout this journey?
I will start by addressing the medical students and the young aspiring medical students, let's say, right? So if you are in medicine, I just want you to please always remember that we are here to serve humanity. And there is nothing more grand and more noble than what we do. And so, despite all the systemic issues that we face in practice in medicine, no matter where you are in the world, I want you to always remember that what truly matters is you actually taking care of other people, of healing other people. And I'll leave you with this advice that my parents gave me when I started medical school. They said, you know what, Iman, just consider any patient that comes through the door to be one of us, your parents. I mean, wouldn't you want the best to your parents? Wouldn't you want your parents to be educated about their disease, to explain to them what needs to be done next, and to give them the bigger image of what the plan is going to be in the future, and to just give them the best? And with that in your mind, you're always going to want to be the best doctor and the best surgeon to serve these people where you see the most precious people to you, right? So this comparison had stuck with me forever. It's always on my mind. And so I want you to, as much as you are spending time and investing in your clinical knowledge and your surgical skills, if you want to go into surgery, I want you to also invest in learning how to communicate with patients, how to translate the empathy that you feel into something that patients can connect to. That's just as important when it comes to taking care of patients. In regards to what I would tell myself, that also applies to all of you listening today. I would say, please take care of your health. It's a long, long, painful journey. Please work out and please drink water and please try to have good sleep. And I know that for a lot of you, this may sound completely ridiculous, especially if you have your board exams coming up, if you have some finals coming up. But truly, when you get to my age, I just turned 36 a couple of weeks ago. You start to feel it hard, you know? And so investing in your health is going to be the thing that's going to take you really far. And truly, half an hour of any type of physical activity is not going to change your whole study or career trajectory. Just do it. It's 100% worth it.
That is a wonderful piece of advice. And as a neuroscience major myself, you actually retain more if you go to sleep, even if it's just for 5 hours, and it is scientifically proven. And so I remember my professor was telling me the exact same thing to the
Yes.
whole class, that you need sleep. And, not even just for your, retainment of knowledge, but also just for your physical health. It's very important.
Absolutely.
And also working out is very important as well. And doing it for your body and just like to be healthy. It's something that I've started to incorporate more frequently this year. So I'm very happy that I'm
I'll be
doing it.
checking on you, Jihan. I'll be checking on whether you're working out or not.
Okay. I have to try Pilates because I know you've done that before, if I
It's
found correct.
incredible. Okay, let me tell you something. I must admit, I was very judgmental before I ever tried Pilates. I thought the people who
Well,
went to do it just looked cute. That's why they do it. But when I
and it's
tried it, when I
expensive.
tell you, it's an incredible workout. I feel the strongest I've ever been. I highly recommend it to everybody, men and women, by the way.
I really need to do one. I was like looking into some classes and I think they're honestly quite expensive, but I'm willing to spend the money.
Yes,
Yeah.
it is absolutely worth it. Worst case scenario, we can all work out for free. We can all
Yes.
have a little walk or watch a YouTube video and do some workouts at home. And maybe whenever you get to try Pilates, I have no doubts you're gonna love it.
I'm sure. It sounds so amazing. And then just one very quick question. This is not really related to the podcast, but I know the World Cup is coming this year. So as a Moroccan yourself and also as a Moroccan myself, like, are you super excited for the World Cup and are you gonna watch any games in person in the
Well,
US?
listen, I'll tell you something. I'm obsessed with, we call it football, so I'm just gonna call it
Yeah,
football.
football.
Sorry, my American friends. I cannot get myself to say soccer, but I'm very, very excited about Morocco being in the World Cup and the World Cup being in the US. And I've been looking at tickets every day, and they're pretty expensive, but I have a feeling I may spend some of my very hard-earned money as a new attendant to get to at least one of the games. So one of the first games is going to be in New Jersey. And I'm
Yeah.
going there. I already have a trip planned that weekend, even though I don't have tickets yet. And so I thought, worst case scenario, if I cannot find a ticket, I'll just go and watch with Moroccans somewhere in New York. And I'm sure it'll be just as fun.
It definitely will. And there's a city, I think it's Brooklyn, if I'm correct. It's in New Jersey. No, that's in New York, but it's either New Jersey or New York, and it's all Moroccan. And I've been there a few
Yes.
times with my family, and it's super fun. So
There's
you
a
should.
big Moroccan community. That's why I had no worries about finding people to watch the game with. But I'm very excited. I have a big feeling, a strong feeling, I should say, that the Moroccan team is gonna achieve some big things. And I'm very, very much optimistic and looking forward to it. I'm obsessed with football. Only Moroccan football, by the way. I don't watch any other games. I'm just obsessed with when Morocco plays football. So let's put it this way.
Honestly, I'm the exact same way. And
Yeah.
I still need to get the jerseys that just came out.
You have to get the jerseys. If you can get your name on it, that's also pretty cool. I've done that before. I mean, it's just gonna be so much fun. And I always ready with my red lipstick and my green like eyeshadow to have the Moroccan flag on my face.
Yes, I love it. So patriotic.
Yeah, absolutely. I love Morocco. I'm a proud Moroccan. I'm so proud of you. And it's
Aw,
truly an incredible pleasure and honor to do this podcast with you. And I wish you all the best. You're gonna do some amazing things, I have no doubt.
thank you so much, Dr. Tanib. And as we say in Maghreb, Dima Maghreb.
Dima
Um,
Maghreb, that's right.
well, that was all for today's podcast. Thank you so much, Dr. Shamib, as this conversation was truly inspiring, and I'm sure a lot of our listeners gained a lot of information and benefited from it. Your journey, your research, and your continued commitments to making medicine more accessible and honest is something that we can all learn from. And I will make sure to list all of your social media platforms where our listeners can find you on social media and also like on LinkedIn, Instagram, etc. If they would like to connect further. And to our listeners, thank you so much for tuning in to this month's episode of the Medicine 101 podcast. See you all at the next episode.
See you on the next one.
Well, that was all for today.